In-home supportive services is a state program, and it's locally administered by counties. And we're the second largest county in the state with 25,000 recipients. And this is a program that's designed for low-income individuals who are eligible for Medi-Cal to receive services to allow them to stay in their own home and avoid hospitalization, nursing home placement, or board and care. So social workers go out into the home, meet individually with an applicant, and talk with them about what are their needs for service. They come up with a certain number of hours. That information is communicated via a notice of action, a formal document, to the recipient or applicant, and then they find someone on their own to provide that care. The recipient is considered the employer of their care provider. And as such, they can hire whom they wish. They're responsible for hiring, supervising, and training. And they often will turn to a family member. Our Board of Supervisors is very supportive of the need for individuals to receive care in the home. But when they looked at IHSS as a state program, what they really saw was a program that was careening out of control in terms of growth.
We wanted to ensure that the 25,000 people that we're counting on to achieve the independence and living in their home, quality of life, we're getting quality care and we're getting it by the right people.
They also looked at the integrity of the program, and they said IHSS is a tough program. There's no criminal background checks for providers. There's no one verifying that the service is being provided to that recipient in the home, and there's no one making sure that everything is going well and as it should.
Fraud comes in many forms. Fraud comes in people who misrepresent themselves and their ability to be eligible for a program. Fraud also comes from folks that claim to be the right individual provider of care for a person in need and in fact is not.
So my team developed the IHSS Program Integrity Unit. And what they do is they make unannounced visits to the homes of our IHSS recipients to make sure that they're receiving the care that they were supposed to receive and that it's the right level of care, whether they're receiving the services that are being claimed for and billed for. We also have checked to make sure that we aren't billed for periods of time when the client is actually in the hospital. And we've also been able to determine that some folks may need a higher level of care and make those referrals back to the social worker. One of the other functions we perform is to determine on an ongoing basis if people have died so that we can close the cases timely.
The entire project has been a deterrent of fraud. In February of 2011, we partnered up with the Department of Public Health and Vital Records, which is a department in the County of San Diego. We were given access to their database listing those who have died. We take these names and we screen them, and if there's a match of an active client with someone who has passed away, we let IHSS know. That's actually a big cost savings. The providers are not being paid for services that they should not be paid for because the client has passed away and is ineligible. Since the start of the project, we have screened approximately 17,000 names. We have found approximately 700 matches, which has resulted in about $530,000 cost savings.
We've made 2,500 unannounced home visits. We've made referrals to our district attorney, fraud investigators, and to state investigators when we see that there may be abuse of the system. I think our Program Integrity Unit performs an important service because it assures the taxpayer that dollars that they've put forth to help needy people are being spent the way that they should be spent.
What we find more times than ever is that services are being provided in an excellent fashion in the home. But for those vulnerable individuals for whom this care is a lifeline, we're able to verify that, and if there is a problem, do some follow-up. Our board sent us down this path because of the careening costs in IHSS. 8 to 10% a year was of grave concern, that level of growth. What we've seen since we began our reform efforts is that growth. The first year we went from 8 to 10% to 4%. Since that time, we've gone into the negative zone. If you consider an average of 8% growth being equivalent to about $20 million, in the past 2 years, we've been able to save that amount of money.
It's very gratifying to see this work being recognized. It's important work for a very vulnerable population.
We're truly honored to receive this CSAC Challenge Award. It means a lot not only for the men and women who work for the Health and Human Service Organization to acknowledge that their work is valued, but it's important for our community, for our County Board of Supervisors, and our goal of ensuring that what we do good for San Diego is something that hopefully could be a benefit for the rest of our great state.